Hello, I'm Dr. Karim Miani, a medical doctor and geneticist. I recently joined Kensington International Clinic. In this short presentation, I would like to introduce myself and explain what I can offer to patients. I briefly cover the role of genetic tests in gastrointestinal health, and I'm actually available for genetic consultations that I see on Mondays. If you'd like to chat more about the subject, please let me know. There are actually three important steps for genetic analysis in patients at risk of hereditary GI cancers. First, selecting appropriate patients, then to do a simple saliva test for the DNA analysis, and the final steps is post-test management, including counseling and surveillance plans. So when we refer patients, actually family history can be suggestive of hereditary GI syndromes. Early onset colorectal cancer or multiple polyps may indicate underlying genetic predisposition. Unusual presentation of GI diseases can also sometimes indicate genetic factors, and on top of that, patients with known genetic mutations in their family, they should be considered for genetic testing. As you know, early detection in colorectal cancer is very crucial. A simple saliva test can identify genetic risks for colorectal cancer. Family history and the pathogenic variant in cancer genes may increase the risk, so we always consider a DNA test for personalized risk assessment. This is the result of one of our cases who was worried about the recurrence of colorectal cancer that runs in the family. You see that the first page shows increased risk for colorectal and also gastric cancer to some extent. We advise the patient to closely monitor their GI systems such as colonoscopies. We may also test their other family members to see if they have inherited the mutation. The bar chart indicates the risk of developing colorectal cancer that is higher than the normal population, specifically at 75%. Given this increased risk, the following medical advice will be recommended, and it will be mentioned in a letter to the consultant or a GP. So, dietary changes, regular exercises, maintaining a healthy body weight, or other medical interventions such as colonoscopy or surgical counselings. So, in summary, in pre-test session, we will address potential concerns, explain the genetic testing options, and discuss potential implications. After that, if appropriate, we will perform the tests, and in the post-test genetic counseling, we will interpret the test results, discuss the implications for the patients and family, and also provide appropriate recommendations. Follow-up communications will be performed. We will write detailed letters to GP and GI consultant, providing specific recommendations for surveillance, reassurance, further testings, and family history. And for any further questions, please do not hesitate to contact me on my email and my WhatsApp. And thank you for listening.